reason that I chose Lillian Wald. My heritage is similar to Lillian Wald's. My grandparents settled in the East from Germany, where my grandfather, Edward Schuster, fought in the war. He was a doctorate in philosophy and foreign language. He advocated for the rights of the poor. He published many articles in the Social Justice Review. On his deathbed, he was finishing his book, and his fourth and final book, Human Rights Today: The Demise of American Values. My grandfather was not a famous man, but a devout Christian who used his position to unify people of color and social class through his teachings and his writings. Lillian Wald was an American nurse, a humanitarian, and an author. She was known for her contributions to human rights, and she paved the way for community nursing and public health. She advocated for women's rights, rights of the poor, human suffrage. She is now in the New York University's Hall of Fame. Lillian Wald reformed nursing, but even greater, she transformed society. I selected her for this project because I myself have a deep passion for public health, health promotion, prevention, and wellness. Here is Miss Lillian Wald. Miss Wald, thank you for coming to join us today for this important interview. Where were you born, Lillian?
I was born in Ohio in 1867. I was born in a very small family, a Jewish family.
And can you tell me a little bit about your childhood?
My parents and grandparents arrived from Europe with their own wealth and success, but I became a Christian despite my Jewish upbringing. Our family were mostly German Jews. Jews were a minority, and I went to a boarding school for girls. I was given music lessons and art lessons. My family moved to Rochester, New York. When my sister Anna was born, I met a nurse and decided nursing would be for me.
So that's how you became a nurse. So what drove you and moved you toward your vision in nursing?
Well, first I was rejected by the School of Nursing because I was too young. So I went to the New York Training School for Nurses. I was 22 and I graduated in 1891. I wasn't satisfied with my roles as a maid doing general women's duties. I wanted more. After I graduated in 1891, I worked with the children in the juvenile asylum on 176th Street. There, most nurses were Christian. While I work in the children's asylum, I could see that I could make, while I worked in the children's asylum, I could see that I could not make any changes. But working there made me upset, so upset that I decided to become a doctor. And so I went to school in Manhattan to do that, and to do just that. I attended women's school in 1892.
And tell me more about after you graduated. What did you set out to do?
Well, in 1893, I began to notice that people's economic status was very much related to their sickness. People's illness was causing them to become poor and vice versa. Sickness should be considered within one's social and economical level. A person's health could not be considered without also taking into consideration the health of population. You know, between 1500 and 1800, hospitals were associated with religious organizations. People were cared for in the home. Institutions were not built to support public health.
So, tell me then about public health. Who coined the term public health?
Well, I was not the first public health nurse, but I was also the founder of public health nursing. I actually invented the term public health nurse. I was hoping to start a new role for nurses to visit the homes of the sick people that were like me, but the other nurses couldn't come up with resources they needed. But I just happened to be connected to some well-to-do people that supported my cause. They saw how filthy the living conditions of the poor were, all the disease in the places.
I know your faith was a big part of your movement in public health. So can you tell me more about your religion and how it impacted your work?
Well, I belong to no religion. I'm neither a Jew or a Protestant. I follow Christ, and my fellow sisters are part of the gospel movement that existed to reform social classes in America. I respect all religions.
What was your first act of public service?
My first act of public service was I made all impact on my readers. I wrote this book. I wrote for the Atlantic Monthly. People that read the Atlantic were mostly professors and politicians. I began to raise their awareness.
Nice. And so, tell me, the Henry Street House. What was the Henry Street House?
The Henry Street all started because a Sunday school needed a course for immigrants, a home of a nursing class. I didn't know much about the surroundings there, but I arrived and it was horrible. It smelled, it was filthy, people were living in cardboard boxes. In the sick room, I saw firsthand the way society turned their back on them. The people were sick poor, so I decided to live in a neighborhood with them. I believed that disease among the poor were beyond their control, and that the care of the people needed to take account into the social and medical aspects. Care must be done according to each person's perspective. I later moved to the Lower East Manhattan, which became the house of Henry Street.
Wow. So what happened at Henry Street?
Well, I founded the Henry Street settlement movement, settlement house in 1894. I wanted to shape the idea of health and social status. My vision for Henry Street nurses was to better the communities in which they lived. Towards the end, Henry Street settlement consisted of 54 nurses. First aid, classes for kindergarten, boys and girls club. My favorite part about the Henry Street was it was a place anyone was welcome. It decreased suffering of all ages and walks of life. There was something magical because it stood for good, pure things, helping mankind in the setting for the poor free.
And who actually, Miss Wald, who funded your projects? Who helped you with that?
It was a combination of social ties, but Mr. Schiff was a powerful man. He was a Jew. He gave a lot of his wealth to school systems. Mr. Schiff donated the building, horses for children's camps, books, materials for classes, and even a Ford machine to take people to places.
And who were some of your other mentors? I know Mr. Schiff, he really believed in your cause and was behind it. It sounds like 100%, but who else helped further your vision and mission to bring public health to the community?
Mary Brewster, Jane Addams, Florence Kelly, and even some others, like my friend from nursing school, Mary Brewster joined me in my quest. We got financial backing first from Mr. Loeb. He was a Jew who allowed me to purchase the house on Henry Street through Mr. Schiff. Mr. Schiff was called the bank.
And then after you became, after the Henry Street settlement became successful, and what became of your vision at the Henry Street house?
Well, by 1910, we had about 54 women on staff at Henry Street, 3 homes and lots of first aid centers. There were about 30,000 involved. I wasn't the only visiting nurse. We would provide care to people in the living on the Lower East Side of Manhattan. We provided classes to them too. Our agency and worked in that poor part of Manhattan started to flourish. Our nurses made over 140,000 home
Wow.
visits, including maternity care eventually. And we also had kindergarten classes and all kinds of home and art classes. It became a hub for learning growth by 1912. We needed to reach out to our communities and provide people with visiting nurses to restore the poor. That was kind of our main goal. I was also a businesswoman. I helped Metropolitan Life Insurance to hire us visiting nurses to help reduce the number of health benefits. It cost the company about 5 cents per policy and 50 cents per visit. So about 1 billion home visits were done by 1952. Mary Brewster and I worked for Metropolitan Life as a visiting nurse in Manhattan in 1899. We were some of the first community visiting nurses. We were part of the Visiting Nurse Association. We established nursing services for companies and like having a bath or getting first aid, over getting educated about health as well. This was the beginning of that separation. Health was almost for the elite. Health education was too narrow and too focused. I wanted so bad to improve the sick, poor conditions, and I had a mission. By 1912, we cared for certain diseases, which allowed nurses to begin specializing the way nurses cared for the basic needs of the community, which shaped how and what nurses did. It became obvious that people needed basic caretaking.
Nice. So, what were some of the other things that you accomplished during your career, even after Henry Street?
In 1912, I promoted Congress to create a children's facility because women and children needed specialized care. By 1915, public health nurses became to specialize. By 1920, we had even more types of nursing, even mental health nursing. I helped start on-site public school nurses in 1914. The death rate for children under 2 was 30% lower than deaths of 2-year-olds in the hospitals. In 1918, the Spanish flu hit. I made a system that saved lives by tracking patients. Yeah.
So that's amazing. What was public health like at the end of your career, and what would you say to nurses today?
In public or community nurses, we could see the big picture helped us understand kind of the whole environment. We could access cause and effect. We could minister the spirit of a person. We need to be clear about our mission and suspend our prejudice about the poor and underprivileged class. Forget about racism and class, and to train more nurses in public health in schools.
Nice. So yeah, what would you say if there was another pandemic?
I would handle it as we handled the flu. Take one step at a time and not make any rash decisions.
And what would your parting thoughts be to a new nurse, let's say, if they're seeking to become more on the public health? What would you tell him or her?
That we need to start teaching prevention to young children in schools. That's a main thing.
Okay. Well, I noticed there's a symbol on the wall. Can you tell me a little bit about that? What is that?
This Chinese symbol is actually called BOA, meaning Universal Brotherhood. It was a symbol for my vision at Henry House.
So your street, Henry Street Settlement House, was really your vision, that you wanted to bring people together and create a place of unity. And it sounds like you had a Christian focus to your work, where you really wanted to help others that weren't as fortunate as you. What would you say about that?
I would just say that it was more of not a vision, but our mission.